morning, everyone. Welcome to This Day. Today is Tuesday, and it's April 7th. Now, who we have on our show today, we have a surprise visit from Jeff Parker, who is here to tell you some amazing information. It's really good news for the community. And then we also are going to have Assemblywoman Cotty Petrie-Norris, and she is going to talk to us about all sorts of different things. Of course, COVID-19, some interesting things about the Social Security checks that Katie Porter had talked to us a little bit about, so she's going to expand on that a little bit. And then, of course, if we have time, we're going to go into spruce up your home, so only if we have some time. Now, what we have on our regular programming, which we've been doing every day for you, is to tell you a little bit about the website. So let's go ahead and do that again now. So ochealthinfo.com is where you're going to want to be. And as you can see, we have right there, we have the ochealth.com, info.com, and then you would click on this button in the middle, and then it would bring you to the next slide, which now will be right in the middle, and you would check COVID-19 case counts and testing figures. And that'll give you mostly up to date. They do change that daily, so you should be able to, see that. Then our own website, which we have you go to ochealthinfo.com, and then I also found out you can go to cdc.gov, and they will also have some additional information for you, but that's more of a broader scale. All right, then for our information here in Laguna Woods, you can go to lagunawoodsvillagealerts.com, which is the new website. And as you can see the picture there, it has all of the choices on the right-hand side of the screen where you are able to choose what information you want. Either you want COVID-19 information, you want to know what restaurants in the area, delivery. There's a whole plethora of different things that you can just click on. Then, of course, we have, this is down below. You can check other things. So TV6, we are now airing got them up for you so you can take a look at the interviews that we've done with Jeff and some other ones there. So good stuff. You can also email us at info@lagunawoodsvillage.com, and then you can always go to our recorded hotline, which is 949-268-2019. Now let's take a look at our weather. Boy, rain, rain, and more rain. We do have a little bit of a break right now, and it's looking okay, but we are still expecting some rain, thunder clouds today, thunderstorms 62-50, then showers and cool tomorrow 58-52. Thursday, showers again 59-49, and then Friday, cloudy with light rain, and that's at 65-53. And then by Saturday, we are clearing out of rain, and it's going to be partly cloudy with 63-56. Now, take a look at this gorgeous photo. Guess who it's from? It is from Mark Rabinowitz. Thank you, Mark. It looks beautiful. Our sunrise this morning was at 6:30, and our sunset today is at 7:16. And then, of course, if you have a beautiful sunrise or sunset picture from the local area, please email it to us at lagunawoodsvillagetv@gmail.com. All right, well, stay tuned. We're going to have an update from Jeff Parker, and we'll be right back after this.
Hi, Laguna Woods Village. To make sure you are getting the latest and greatest from Village Television, here's how to rescan your TV. Press the menu or setup button on your remote. Press Channel Scan, Scan, Rescan, Tune, or Auto-Tune. Be patient, the scan process may take up to 10 minutes. When scanning is complete, your TV may display the number of available channels or return to your program. Now, you can watch original shows, first-run movies, and stay up to date on everything happening in your community. For more specific directions, search How to Channel Scan in your TV's manufacturer online, or call Broadband Services at 949-837-2670. That's 949-837-2670.
Welcome to Harvard Eye Associates. We have been proudly serving Orange County for over 40 years. We are excited to announce our Laguna Hills location is now located at a larger state-of-the-art facility, located a block away from our previous location. Our new facility is conveniently located next to Saddleback Hospital and across from Nordstrom Rack at 23961 Calle de la Magdalena. Come join the Circle of Care at Harvard Eye Associates, where the future of vision is today.
Hey Laguna Woods, it's Ken.
And Lisa.
Did you miss an episode of This Day? Not to worry. Head over to youtube.com and search Village Television.
Here you can find each episode of This Day and other community programs such as Good Day OC, Discovering Laguna Woods, and much more.
Just click the red subscribe button, then click the bell to be emailed every time we upload a video.
Don't miss out.
And subscribe today.
Welcome back. Well, as I mentioned earlier, we have some really good news to share with you, and I have Jeff Parker here who is going to tell us. Look at that smile on your face. Well, thank you for joining us this morning.
Good morning, Lisa. How are you today?
I'm really good. Good news.
Good news.
Great
yes.
news.
I'd like to tell the residents of our community that, and walking through this whole issue of the Ayers Hotel, on Monday morning and over the weekend, our legal team and our staff were putting together our legal approach to how we were going to try to keep this from happening. On Monday morning, along with the city, we filed for a restraining order and an injunction trying to keep this from happening. In the meantime, while we were discussing it with our legal team in the morning on what the next approach was and setting up for the hearing that was scheduled for Tuesday, we got information back from the county attorney that indicated that it was kind of a moot point because of information that they were just about to provide for us. What they provided is that Don Ayers III had gone through the process of rescinding or requesting a rescinding of the lease agreement for the Ayers Hotel over the weekend, and that had been received by the county, and the county accepted that. So no longer is the Ayers Hotel in use, or will be in use even, because it never really started.
Right.
But they will not be using the Ayers Hotel to house homeless people with COVID-19 or those showing symptoms of COVID-19.
Right.
So a great victory for our community, and I just wanted to come on and say thank you to all our residents, number one. They just got out there and they made their phone calls, they sent their emails, they came out and had the small little protests out here in the parking lot.
Right.
All of those things add up and were great for sending the communication that, hey, we are a very at-risk community here. Why would you put this right in the middle of that? And that's the message that we continue to send to the county and to the Ayers family. Not here.
Right.
We understand the need, but not where just one possibility of an outbreak could spread into a community that is clearly the most vulnerable, potentially the most deaths by this, and we just didn't want that to happen. And like I said, the residents stood up and real strongly and sent that message, which really helped our ability to communicate. I reached out, and Don Ayers reached out to me on Friday over the weekend. We had several conversations, and I just again asked him if he would really reconsider this location as a possibility. And he did that. I really thank him he and his family for going back and reconsidering that and making the request to the county. So a win-win for all of us, I think, in the long run. And so again, I want to thank our legal team, Jeff Beaumont, Sandra Gottlieb, and Kelly Richardson. They are the attorneys for the mutuals. They just did an outstanding job with their teams, putting all of the legal work together. And my staff, kudos to everybody that worked on this. And so we're just so happy, and it's a new day for us. And now we can go about dealing with our day-to-day operations and hopefully sending the message out to the community that at least this issue is you're safe now, but we want you to continue to follow all the rules and regulations that are out there. Stay home, be safe. And in fact, what I'm hearing is there'll probably be a new regulation coming out or a new recommendation of wearing a mask anytime you go outside.
Well,
so I think that's important.
And I think that was because they have some sort of proof now where it can stick around for a little while in a certain area. So if you've got someone that's sneezing or coughing in that, and you happen to walk through that area, then you have to be careful. So totally understand. So speaking of operations, there's going to be a go-to meeting. Tell me how that's going to work today at 9:30.
So we're doing, all of our board meetings now are going to be virtual for the month of April.
Okay.
And today is our first one, GRF this morning. So we'll be doing that virtually. We'll be using GoToMeeting for that. There'll be, prior to the meeting, there'll be, you'll be able to get an email and a phone number where you can send your emails or phone number or phone calls in that you have a question with regards to the agenda. Channel 6 will carry it.
Yes.
And put up the agenda so people will be able to see that.
Okay.
But it's going to be held virtually. There won't be anybody at the community center. There won't be anybody in our headquarters in the boardroom as far as the board members. There'll be a couple staff people helping coordinate this. But a new adventure for us.
Yeah.
A new opportunity for us, though, to take a look at how we can continue the social distancing and making it safe, and still do our business.
Exactly. First time for this. So bear with us because we don't know what's actually going to happen. So hopefully it'll all go very smoothly. So, all right. Well, excellent. Well, thank you so much for the information.
And it's great to come on and have that kind of good news.
Yes, celebrate in your own home. Thank you again, and we'll see you tomorrow with operational information.
Thank you.
All right. And we'll be right back after this, and stay tuned for Assemblywoman Connie Petrie-Norris. Welcome back. Well, today we are joined via Zoom interview by Connie Petrie-Norris, our Assemblywoman here, and she's got some updates for us regarding the coronavirus as well as a variety of other things. Well, thank you, Connie, for joining us. I really appreciate it. I know you are a busy woman these days, as always.
Well, it is good to see you and be able to catch up, even if it is just virtually.
So let's talk a little bit about sort of what's happening. I mean, the situation in California is sort of ramping up is what we're hearing. And we have been referring our residents to the Orange County Health Info Department, their website. And so they're able to catch up on many of the cases. Maybe you can share with us some of the new numbers from today.
Well, as you know, Lisa, this is an unprecedented crisis. And here in the state of California, we have more than 15,000 confirmed positive cases of COVID-19 and 348 deaths. Here in the county, we have 843 confirmed cases as of yesterday, and sadly, we have had 14 Orange County residents who have lost their life to COVID-19. Mm-hmm. Here locally and all across the state, we are really focused on three absolutely critical priorities. Priority number one is flattening the curve in order to slow the spread of this disease. Priority number two is building surge capacity all across our hospitals and medical systems so that we can take care of people in California and here in our county. And priority three is providing relief for the families, the workers, and the small business owners who have been absolutely devastated by this pandemic.
Right. And one thing that we've been really trying to let everybody know about is, you know, the social distancing, the staying at home. And our residents really are doing a very good job of that. So would you say that across the county and across California, they're doing a pretty good job of that?
Lisa, I would. We have asked 40 million people in the state of California to be part of the solution and to be part of this fight. And people are heeding the call. They are heeding the governor's call to stay home and to save lives. And what we are seeing is that the swift and decisive action that California took under Governor Newsom's leadership is bearing positive results. When you compare where California is with some other states, we are in such a better position. And while the road ahead is very long and we've got a tough fight ahead of us, we are feeling cautiously optimistic about where we are today. And that is all due to the 40 million people in California who are staying home and saving lives.
Excellent, excellent. So you did mention as your item number 2, in terms of our resources across California, having enough hospitals. What are some concerns there?
Well, Lisa, I think we've all seen the horrific images and we've read the heartbreaking news stories of patients in other countries and patients even in other states dying in hospital corridors because there just aren't enough hospital beds. And California is moving as swiftly as possible in order to build surge capacity here in our state in order to avert that nightmare. And let me just share kind of the scope and the scale of the challenge that we're up against. So here in California, we have 75,000 hospital beds. Mm-hmm. We anticipate that when the COVID-19 surge hits in approximately 6 weeks, we need an additional 50,000 hospital beds. Mm-hmm. That's an increase of 67% in just 6 weeks. A Herculean effort is underway all across the state in order to meet this challenge and ensure that we've got enough hospitals, we've got enough hospital employees and medical professionals, and that we've got enough personal protective equipment. As some of our viewers may have seen just last week, as part of this surge capacity planning and in order to meet this challenge, Governor Newsom announced that we would be reopening the Fairview Developmental Center in Costa Mesa. And the Fairview Developmental Center is going to provide absolutely critical surge capacity here in Orange County, and it is going to save lives.
Okay, and now let me ask you, in terms of, we've seen the Army and a variety of other military operations going on in New York. Is that something that they're going to be looking at here in California?
Well, yes, the governor has already called up the California National Guard, and they have been deployed for humanitarian missions related to COVID-19. They are staffing up food banks and doing other really critical work during this time. And the expectation is that we will be able to draw on some of those members who are medical professionals to provide some of the capacity we need. And again, just last week, Governor Newsom announced the creation of the California Health Corps in order to recruit medical professionals who may be retired, maybe have a license that has expired, maybe they're students who are about to complete their training. And California has said, we need you to be part of this fight. Just last week alone, we had 80,000 people who signed up to be part of the front line in the fight against COVID-19. 80,000 doctors, nurses, phlebotomists, nursing assistants. And it's that kind of news, I have to say, Lisa, that even in the midst of what is a very dark and scary time, when I see that there are so many Californians who are stepping in and stepping up to do everything that they can to help us win this fight, it renews my faith and it gives me hope that we will prevail together.
I didn't know what that health opportunity was. And my brother, who's a dentist, told me that he signed up for it and I didn't know. So I'm glad that you said that, because I had asked him what it was. But dentists can do it too, any type of licensed professional, correct? Yes, we need medical professionals all across the state and in so many different areas of expertise. Okay, well, that's awesome. So let's talk a little bit about what's happening right in our backyard here next to Laguna Woods Village. The Ayers Hotel is actually a site now for COVID-19 patients. Can you elaborate on sort of what's happening there? Well, as many of your viewers were, and as the City Council was, I was very surprised by the announcement last week that the county would be utilizing the Ayers Hotel as a site for capacity for helping our homeless residents who either need to be isolated due to COVID-19 or who may be showing some symptoms of COVID-19 or may indeed even be positive. Mm-hmm. And while I and state leaders and county leaders
are all aligned in the fact that we must act quickly to protect our homeless population and to ensure that this thing doesn't spread like wildfire throughout our homeless community. I am urging and will continue to urge our county leadership to identify a more appropriate site to do this for South County. And so conversations, as you probably know, are continuing in this regard, and we'll continue to push for, I think, a more appropriate solution.
Okay, well, good. Well, thank you for your support and information on that. We definitely will keep an eye on that. We had Congresswoman Katie Porter on last week, and she did allude to the CARE Act. So tell me a little bit more about the CARE Act and sort of what does that mean for our senior community?
So as part of the CARES Act, which was a $2 trillion federal response and stimulus package to help the families, the workers and small businesses who are hurting so much from COVID-19, the CARES Act does a number of things. And one of the big pieces of it is direct relief payments to most Americans. So anyone who earns up to $75,000 a year will be entitled to a payment of $1,200 per adult in a household and an additional $500 per child. So that is a payment of $3,400 for a family of four, for example, right. Or for two adults living together, that would be $2,400. And what's really important about this is you don't need to do anything to apply as long as you have completed either your 2018 taxes, your 2019 taxes, and or you are already a Social Security recipient. You will automatically be receiving this payment from the federal government, either through direct deposit, if they have those details, or through a direct check. So there is so much more that we need to do, but this really was a very, very positive step forward.
Okay, and is that supposed to happen? Do we have any time frame yet?
What we've been told by the federal government is that they are moving as swiftly as possible to get those checks and get those payments to Americans and to Californians, and that the initial disbursements will be going out as soon as April 13th.
Oh, okay. Okay, great. So what are some things that we can do beyond maybe the staying at home? What are some of the things that we can do?
Well, for those of us who are in a position to continue to help those in our community, you can do that virtually. There are so many opportunities to be part of this solution. We're in a period right now where so many people are hurting. So many people don't have the money to buy food, to pay their rent. They've lost hours or they've lost employment as a result of this. Mm-hmm. And alongside that, what we've seen is just an unprecedented number of people who call our office each and every day and say, what can I do to help? And so I'll leave viewers with just a couple of suggestions. So just recently, the governor announced his Stay Home, Save Lives, and Connect program. And this is really focused on our seniors. And so if you are in a position where you can help other folks in your community, you can get involved as part of 211. So 211 is a nationwide organization that provides a one-stop shop for folks that have questions and concerns at any time, but particularly right now in the COVID-19 era. This is a one-stop shop for people who have questions about, how do I get my groceries delivered? How can I get my prescriptions delivered? I've lost my job. How do I apply for unemployment? So for viewers listening, if you've got those questions, you can call 211, or you can utilize the governor's senior hotline, which is 833-544-2374. And if you find yourself in a position where you actually have some spare time now that you're at home, you can also sign up to be a 211 volunteer and help others navigate this really difficult time.
So how does the 211 work versus the phone number?
So the phone number was set up in partnership with the AARP and a couple of other organizations in order to broaden the capacity of 211. Okay. You can call either of those numbers and you can get help.
And that could be either through a landline or a cell phone, correct?
Correct, yes.
Okay, good. And then how do people get a hold of you if they want to express their concerns, throughout anything that you've mentioned here, or their concerns about the Ayers Hotel? What contact information would you like them to use?
My office is here to help. Like you, Lisa, and like so many folks all across the state and the country, we have gone virtual, but our offices are very much open, and we are here to help. Our number is 949-251-0074. And if you've got questions about how to receive your payment from the federal government, if you've got questions about how to file for unemployment, if you are a senior and you're having trouble getting access to your prescriptions or need help with grocery delivery, please call my office and we will help.
Okay, perfect. And then, of course, it's always very easy to find you on the internet because of your unique name. So we could just type in Patty, and I would imagine it would bring us straight to the website to get in touch with you, correct?
Exactly. To find me, to find my office, just go to Google and Google Cottie, Cottie.
All right, perfect. Well, I really do appreciate you taking the time to meet with us. A lot going on right now, and the more often that you can fill us in, the better. So again, thank you.
Well, thank you for everything you're doing to keep our community updated in this absolutely challenging time. And before we go, I would also like to say a huge thank you to every one of our medical professionals and our first responders who are on the front lines each and every day, keeping our community safe and keeping us all healthy. And I'd like to say another huge thank you to all of your viewers and to the 40 million people across the state of California who are part of this solution, who are part of this fight. Together, we will overcome this. Together, we will win. Please continue to stay home and save lives.
Very well said. Thank you so much for your time. And maybe we'll be able to connect with you again next week.
That would be great. Look forward to it.
All right. Thank you. And we'll be right back after this.